So I'm going to be talking today about integrating administrative data to better measure homelessness. And just sort of for context, by administrative data, we mean sort of all of the day-to-day large-scale data that we create and collect through the process of delivering public services. So that could be anything from healthcare records to, metro bus trips, although that's not part of this project, but it could be. All right. So just for some context grounding, this is Women in Data Science Puget Sound. So hopefully you all have seen this map before. But just to give a little context, I know not everyone is always aware of the structure of sort of local government work in our region. So King County, we are a county, includes the city of Seattle, but our other municipal areas like Bellevue, Shoreline, and also a lot of our unincorporated areas and rural areas. So you go all the way out to North Bend or to like Skycomish. These are all actually still part of King County in our region. The county is actually the government body that provides most of the backbone health and human services for our region, and a lot of the money is coming through the county rather than the city. So if you're thinking about sort of our homeless response system, sort of dealing with the crisis of homelessness in our region, a lot of those resources actually come through the county rather than, say, the city of Seattle or any of our regional cities. Cities do have their own resources, but King County actually is sort of a surprisingly behind the scenes government body that is handling a lot of the public services in our region. So I've just, we've got behavioral health, so publicly funded mental health or substance use services, housing support service, all of our public health clinics, food and environmental safety, emergency medical services, our vital statistics, population health and epidemiology, which suddenly everyone is much more aware of over the past 2 years, veteran services, services for seniors, vulnerable populations, youth programs, crisis services, our entire pandemic response. All of this is actually held and delivered substantially by county organizations. And so all of these types of health and human services are generating administrative data. So I work as a data scientist for our Department of Community and Human Services. And I work with administrative data to sort of investigate a lot of diverse questions about people and their experiences in our region. So a really popular question we get asked, how many people are experiencing homelessness in King County? Not actually a simple question to answer, and that's going to be the sort of practical question that I come back to as an application of the data system we've been building at the end of the talk. How many overdose deaths are associated with fentanyl exposure? You may have been hearing about a rise in overdose deaths and also a rise in risks of fentanyl in our region. King County and our data science teams at Public Health and DCHS are asking and trying to answer a lot of these questions. How equitably is access to behavioral health services, so mental health or substance use services, distributed across our county? What homeless shelters have the highest proportion of clients at high risk of complications from COVID-19? Are our programs to support school-aged kids resulting in better outcomes as those children age? How well are patients being discharged from hospitals being connected to relevant outpatient care providers? There's a whole bunch of questions here. And if you start to think from these questions back to all of those different service spaces, you can see you're drawing on a lot of data from a lot of different systems. So we hold data across really diverse sectors that are generated through the course of delivering services. So you've got information on behavioral health services that are provided. So people who are receiving treatment for substance use, receiving sort of methadone, sort of medication-assisted treatment for opioid use. You've got anyone who is receiving healthcare through Apple Health through our state Medicaid programs. We have information on their medical care. We have information from our county jails on who is booked in and out of the jails. We have information from our municipal jails on who is booked in and out of there. We have our homeless management information system, which is all of the information on homeless service programs that are being provided with federal dollars in our region. I'm not going to go through and enumerate all of these, and there are even more. So we hold many different types of data about services provided to many hundreds of thousands of people in our region year on year. So with these data, we can answer lots of these cool questions where you're trying to look at how people move through and interact with these diverse systems. But we have a problem. we have had a problem historically, which is that all of these data systems are siloed. There is a sort of stereotype often that government is big brother and that we know everything about people. And I joke sometimes with my friends that I'm kind of playing big sister, where I'm actually trying to create links between systems that are historically very strongly siloed, and there aren't good ways to connect the dots from one person's experience in one service system to their experience in another system, even though often the questions we get asked are precisely at that point of the intersection between people's interactions with different systems. So our data systems are often physically siloed. The data is held in different databases, sometimes in different clouds, sometimes on on-premise servers. Um, Usually there are no common keys between these data systems. There is no sort of global identifier for who a human is. And often these systems have strict legal restrictions that govern how the data can be stored, how the data can be shared, who can have access to the data, what can be disclosed or redisclosed or moved around. So this is sort of the status quo, 3 years ago, is a bunch of data, important questions, and a complicated context to try and answer them. So how do we answer the questions in this setting? So in the past, we operated with a lot of what we would call ad hoc data sharing agreements for specific projects or specific questions. Ad hoc linkages, so a data analyst working with a cohort of people and then running a manual linkage themselves between different systems based on, name, date of birth, social security number. This can be really slow to implement. And what happens is you get very limited awareness or learning across projects. So you have a lot of redundancy of people implementing the same sort of types of linkages across the same types of data, but specifically cannot share it, don't have awareness of what's going on across different teams. So where we have been able to move to in King County over the past 3 years is we've been building out what we call imaginatively our integrated data hub. But what has built out more generalized data sharing agreements. So we've created sort of master agreements within the county that have created legal frameworks where we can consider ourselves single legal entities, even across departments. We've been able to centralize ongoing linkage of client identities across a number of these different systems. And doing this, we've built out formal data governance procedures and oversight. And I think the last point on what we're doing in the present that's sort of had the biggest impact is we've created greater transparency and collaboration between teams. So just, I want to sort of reflect on some of the challenges we've had to doing this. So there's a lack of data standards across systems. And there's a lack of trust between data partners. There's sensitive and protected data that requires new legal frameworks for sharing. So especially like the really sort of big ticket item is sharing any information on substance use treatment programs. This is a highly protected data because of stigma attached to substance use. And so we had to create new legal frameworks to allow us to share substance use treatment data, say with folks in our public health department or vice versa. Interestingly, we have unclear roles and responsibilities between business departments and our IT department. I think this is sort of an interesting sort of I'm not going to dwell on it, but just sort of an interesting context dependent piece for folks working outside of the tech industry, where the folks who are actually doing the data science are often really segregated from the folks who do the IT infrastructure and maintenance. They live in the IT department, the data scientists live in business departments, and the firewalls between IT and the businesses have often been very strong for a lot of historical institutional reasons. Defining use cases and then sort of figuring out how do we do access management and control across all of these. I'm not going to go into the weeds of all of these answers because that would be a 2-hour talk, but just sort of there's a very complex set of challenges. We often get folks coming into Transparent like, why can't you just link, from your homeless service providers to the folks, getting treatment for substance use? It's like you can't just do that. There's a whole series of legal and ethical and technical blockers in place. So we've been able to do this through a really collaborative process. And what's been interesting in this is the work of doing this data integration. I'll show you a little bit of sort of the technical solution is not actually that challenging. The work to do this data integration is actually all about relationship building. and understanding really clearly the needs between different stakeholders in the process. So, we go through a 2-year-long process of just building trust, having ongoing weekly meetings between folks in our partner departments and our IT department, and just hashing out, what does this actually need to look like? What do we need to do? And as part of that, it includes building out a formal governance structure with ongoing monthly meetings, defined roles of who is the data steward, who are the technical data managers, who are our privacy and security sort of stewards in this process, and distributing those roles appropriately between IT and the business. And then one of the sort of interesting pieces was figuring out the bare minimum that needed to be centralized. So this is another instinct that people are like, we're going to build a data warehouse that's going to bring all of these siloed data systems into one place. We're going to create one data model. We can just apply this to everything, and it'll be simple and everyone can use it and get access to the data we need. We found that that kind of big picture global data warehouse really didn't work because of the sensitivity of people trusting how their data was going to be used, or more importantly, trusting that all of the transformation of data into that warehouse was being done correctly, was very challenging. But that the goal was to try and find, where are the pieces that are most burdensome and least efficient for the sort of data linkage on an ongoing basis. And so what we ended up honing in on is saying, we're going to leave a lot of our data out there in source systems. We're not going to try and define a universal concept for what is a service, or what does it mean to be enrolled in a program, or what's a good outcome or a bad outcome. We're going to say the highest cost point in our sort of collaborative data work is that point of identity management and identity linkage. And we're going to put all of our development resources to that project, and then allow those definitional pieces to continue to be done by the business. So it's like trying to figure out that distribution of work between IT, what is the most important thing for IT to take over, and then what are the more conceptual or programmatic questions that are going to end up staying separate. So what we landed on was doing a single centralized linkage process, and that's where we got all of our sort of IT developer focus to lean in on. We managed to persuade them to let go of their dream of building a single data model. We had some data engineers who really wanted to do this, and it took about 1.5 years to finally show them why they did not want to maintain that in the long run. And figured out a way that on a daily basis, we were able to sort of outsource the linkage needs to track people between systems to IT, and hold the rest sort of isolated from the identity linkage. So just real quick, in case people are interested, if anyone out there does sort of identity linkage, you might be interested. If you're not, I'm happy to talk more in the Q&A. We started with just an initial full set of all the clients in the systems we were integrating, ran a sort of client deduplication process using an Informatica proprietary solution, and then set up schedules for refreshing source system client data on a daily or monthly basis, depending on the cadence of the original source system, where we're basically having to find a full set of all clients. I'm skimming this because I'm watching time. Having defined the full set of all clients, we sort of set up an initial linkage structure, and then we're able to just update that on a daily basis. Every day, we just revisit that clustering structure with our new identities brought in. We assign a cluster ID, and what ends up happening is we end up with a single master table of all of our clients attached to their sort of primary cluster ID and a reconciled demographics. So of course, when you have sort of 8 systems providing information on someone, their race, their gender, their ethnicity, all of those demographic features are actually going to be slightly different within each system. So we had to, as part of the data governance piece, define the business logic for reconciling conflicts between people's demographic information. So we took all of those, which are the most costly, most computationally intensive, and most consistently required pieces, and we handed this to our IT department with a set of business requirements and business rules, and created an architecture that basically allows our IT department to maintain what we call our integrated data hub, which is actually just a giant identity lookup table, effectively, but then keeps all of our business data separate in an Azure SQL database that has external tables pointing out to our other data systems and allows businesses to maintain and manage their own ETL procedures into the Azure cloud. So we've created this system where we have a very controlled identity linkage system process that is handled at an enterprise level by our central IT department, but then keeps all of the business data and all of these separate data systems sort of adjacent to it and all accessed within a single Azure cloud environment. This has been sort of interesting, and for the county has not historically been using the cloud, has been a really great example for us of how when you get scalable infrastructure, you can just start to add things to it and like take the pieces that need the most support and figure out how do you build something flexible enough that all of the other partners can sort of gain entrance and exit as they need. There's also a whole security architecture entry I'm not going into, but so we've sort of got a hybrid model where we're integrating where we need to, and we're maintaining that segregated data where it's beneficial for sustainability, basically. All right, skimming right past this. So the thing that people are probably more interested in is thinking about what does this actually allow us to do in practice? So one of the big questions, as I said, I started with is how do we measure homelessness in King County? How many people are experiencing homelessness in King County? This should be easy, right? You'd think somehow it's just counting people. Like this is not, we're not trying to build a recommendation engine. We're just counting things. This is actually really challenging. How do you define the scale of a problem when you know you aren't serving all the people who need help? So if you're coming from like a survey sampling perspective, we have a selection bias into our data systems. Our data systems only represent people who are receiving services. So there's a question of how do you know how many people are homeless if you aren't currently serving them in a shelter or a housing support system? So option one, you literally go out and you try and count everyone who's experiencing homelessness. We actually have a method we've historically done that. It's called the point in time count. And on a night at the end of January for the past, I can't remember how many they've done, but a number of years, this is actually mandated by the Federal Department of Housing and Urban Development. Literally, people would just go out and walk the streets of the county the last Friday in January every 2 years and count how many people they see sleeping outside or sleeping in their vehicles or sleeping in the shelter. So that's one option. Another option, which is what this new data infrastructure we've been building allows us, is to find out what you can know about people's living situation through other systems where they interact with service providers. Both of these, like all of these, are always an undercount. So that's just the other thing that it's important for us to just constantly remember is no one method of counting is ever going to capture everyone. So it's important to count in as many different ways as possible so that you can accurately reflect trends over time. So we know point in time counts and our homeless response system data undercount the number of unhoused people in our region. So we have sort of three main sources of data where we're trying to track this information over time. We have our homeless management information system, which collects data on everyone who is actually being served by some kind of publicly funded program. And this could be they're spending the night in a shelter, or it could be they're in a sort of prevention program that's trying to keep someone housed who's at risk of homelessness, or they've been homeless and they've been rehoused into different kinds of supportive housing arrangements or emergency housing. We have the point in time count that I just spoke about earlier. And then we do know that our other service systems do collect information on people's living situations. Particularly our behavioral health system and what we call our Healthcare for the Homeless network, which is a network of physical health providers who actually do a lot of outreach. They both operate in public health clinics, and they do outreach on the streets and within encampments to folks offering healthcare in mobile settings. Both of these data systems actually ask very detailed questions of clients that they are bringing into service about their living situation, including a high level of detail framed either as the question, where did you sleep last night, or what's your current housing arrangement? In both cases, these questions allow you to say, I live in a house that I own, but they provide a high level of granularity for folks who are unstably housed or housed in an institution. So this is a huge resource for trying to understand who is homeless in our region that goes untapped. So by drawing on these other systems, we're able to find that, sort of estimate that about 7,300 people were likely being served by other systems in our human service setting, who were experiencing homelessness but were not engaged in the homeless response system. I'm just going to bounce through sort of a visual of that and then wrap up. So we know about almost 50,000 people in 2020 who were receiving services to either keep them in housing or to support them when they were homeless. Our point in time count caught just about 12,000 people back in 2020. So that on one night, we counted 12,000 people. We know that nearly 50,000 were enrolled in some type of service around homelessness or housing support. When we add in our behavioral health data system, we find sort of just about 9,000 people who reported that they were homeless to a Be Heard provider in that year. When we looked at the healthcare for the homeless network system, we get nearly 12,000 people reporting homelessness. As you can see in this Venn diagram, it looks like we've been able to add about 10,000 people. I'm just going to highlight one sort of piece of administrative data. It says the reality working with government records. Not every record actually has identifying information we can link on. So in our HMIS system, we allow people to opt out of sharing information. This is interesting from a consent point of view, why informed consent is really important, where it's important to make sure that people are really informed of both the costs and the benefits of sharing their data. Because people who are opt out of providing consent, it then becomes harder to link them and connect them with other services that they might benefit from. But assuming that people who've opted out of providing their information show up in these other systems at the same rate, we get to an estimate of about 7,300 people. Notably, that's over half the number of people we reported in that one night count. So we've added substantially to our estimate of people who are literally homeless, who are unsheltered in our community. And this is work that we were not able to do until we invested in this infrastructure. So I'm going to just end here, and the rest of the slides I can make them available to other folks. But one of the things that's been really interesting about creating this new data resource is by creating new infrastructure, it's actually allowed us to reframe the narrative we have about our policy problem. So by allowing us to go to new data sources instead of going to a census or a survey of the population, we're actually able to set a higher standard for what the policy need in the region is. And that has actually had demonstrable shifts in the policy discussions that have been happening in King County about what an appropriate level of resources and financing to the problem should be. So it's like, as we're thinking about how we use our administrative data to adjust for incomplete data about who needs services and who's receiving it, figuring out ways to overcome those barriers to consistently linking information has really transformed our policy space. All right, I am gonna just call it there to allow some time for Q&A. So I'm gonna see if there's anything up in Q&A. So I've got one question. Is any of this data public? A lot of the mutual aid groups I work with could benefit from some of the aggregated information. So there is a link. I can put a link in this chat to this brief. The data itself is not public. Obviously, this is all person level data. It's highly protected, and we've put a lot of work into that. The aggregate summary data, I'm just going to send a link to a page where we're starting to put up some resources as they come. So if you want to review, oh, that didn't go into chat. Sorry, I'm figuring out how this platform works. If folks want to check out here, you can actually see the brief that goes into more detail on the homeless population analysis and also looks at some overdose information. But yeah, there's not a good way to sort of create this as open data, given the sensitivity of the fact that it is all private data. I also see a question, how do you deal with missing data from people refusing to answer sensitive questions? To some extent, we we can't do anything about that in a sense. If we have people who are not reporting their living situation, we don't know how many of those folks would actually be homeless, experiencing homeless in this analysis. As I said with the consent piece, when people do refuse consent to have their information shared, we only know what we can know, and so that's where we end up making that sort of those assumptions about whether and how those folks would show up in other data systems.
Thank you for the great presentation, Carolina. This concludes our session. If you have